There's a lot of stories that I could share. And so there are some where we see somebody who's very shy, very introverted, kind of in a bit of a shell personality-wise. And they're self-conscious about what they look like, how they talk, how they sound when they talk. And then they go through jaw surgery and you see them transform. It's like truly like the cocoon to the butterfly. And they become social. They have friends. They have girlfriends or boyfriends now, like romantic relationships that was really kind of off the table before. There are significant health changes for patients. We can improve the airway and significantly improve or cure sleep apnea, and that can be very transformative to the patient and buy them many additional years of life by fixing an underlying medical issue. While I'm telling you these stories, there's a young man who comes to mind, and he was in high school, and he came to see me. He had a very severe jaw deformity, and his speech was off. He sounded, he couldn't pronounce words the right way. And he would tell me, he would eat in the cafeteria, and when he was eating, he makes a lot of noise and food. He has a hard time just keeping food inside of his mouth. So it's very embarrassing for him just to eat with friends and colleagues. So he wouldn't, he'd kind of sit by himself. And it got to the point where it was so bad where he was actually thinking about suicide. He had written a suicide note. He had a plan. His parents caught on, and he got some help. And in conversations with his psychiatrist, came out that he was, he didn't like the way he looked. He didn't feel like he looked like a normal person because of his jaw deformity and all the issues he had. I feel like it was really holding him back from just communicating with peers, talking with friends and colleagues. So we were able to expedite his surgery, and we did upper and lower jaw surgery. We fixed some of the chin deformity he had as well, and he looked awesome. This kid went from having no confidence, and he was a stud muffin. He came in for his post-op visit with swagger in his step. It was like, the front desk was like, is this the same kid? It was just really cool to see. And his orthodontist, was calling us, be like, did you do something to this kid's brain? Because he's like a totally different kid. And it's just, no, it's the confidence these kids can get by just looking normal. High school, can be really vicious. A lot of us are blessed with normal bites and normal speech and decent skin and so forth. But I remember in how tough it could be, little blemishes, you get some acne and you're super embarrassed. Well, imagine you have this big jaw deformity your whole life and your speech is off and you have spittle flying when you talk and you can't keep food in your mouth. Like how hard that would be during high school. To be able to help patients from health issues, psychological issues, confidence issues, that is the best part of my job.